Hello friends. Today the topic of discussion is about some urinary complaints. So first of all we will some talk about overactive bladder. The first step is take proper history to reach the diagnosis. Second step is do examination with speculum for prolapse. Third step is midstream urine for culture and sensitivity. Fourth step is do bladder diary for frequency and volume chart for 3 days. Then reduce the coffee and bladder retraining for 6 weeks. The antimuscarinic drugs used first line is oxybutynin, then tolteridone, then derifenacin. And if neurological comorbidities exist, then trospitamide. Second line is mirabegron, and if it failed, then we refer it to multidisciplinary team and some urodynamic studies. Then botulinum toxin can be given by cystoscope like 200 units. If it fails, then we give sacral nerve stimulation and posterior tibial nerve stimulation, which are less invasive. Then if it fails, then we do augmentation like cystoplasty and urinary diversion. And if the old lady is present with overactive bladder, then give her derifenacin. Next is stress incontinence. For stress incontinence, first take the proper history to reach the diagnosis. Then do urodynamic studies. Treatment include weight loss, pelvic floor muscle exercises, transvaginal tape, and if patient is not willing or not fit for surgery, then give duloxetine. Alternatives are bulking agent and artificial urethral sphincter. Next is mixed urge incontinence. First take the proper history to reach the diagnosis. Then keep the bladder diary for 3 days and bladder training for 6 weeks. Then do pelvic floor muscle exercises. Then if it fails, then antimuscarinic drugs and do the urodynamic studies like uroflowmetry and cytoflowmetry. These are only the summaries of these urinary problems. You have to study in detail, but these are only for the last minute review. Thank you and bye bye.